Lovely. Thank you, Ceann Comhairle, and thank you, Minister. And as the Ceann Comhairle said, Minister, tonight I'm actually looking for confirmation on a situation to do with an ambulance base in Carlow Town, and this has been going on for a very long time. We have an excellent paramedic service, excellent in Carlow, and they're in a building at St Dymphna's which is it's not fit for purpose. And originally we had been told that that particular building, they would be moved into another part of the building in St Dymphna's, and then we believed that was to be changed. So in our capital plan, which was great, Holy Angels are getting their new build on what's called the Kelvin Grove site in Carlow Town, which is the HSE land. And then we had received word that the ambulance base was to be built as part of that plan in Kelvin Grove. Again, there has been no clear confirmation on anything that is going to happen. So what I'm asking here tonight is, Minister, I just feel it's very unfortunate that we have the best of paramedics here who have worked so hard, who always work so hard, but in particular with COVID, I know a lot of the lads in Carlow there, I see how hard they work, men and women. They're absolutely excellent. And the building that they're in is not fit for purpose. So what I want to ask you, Minister, is there funding? Is it in the capital plan? And what is the situation going forward so that we can give information back to the paramedics, give them, let them know what's happening, because without the funding and confirmation, it's very hard to know what is happening. And I have brought this up under promised legislation, I have put it into parliamentary questions, and this is going on a long time now. This is not something that's just after happening yesterday or today. This is happening for years now. So what I want to ask is, what is the update on that? And if you could come back to me, hopefully, with an answer on that. But I have a second, really other serious issue for you as well. There's a massive amount of long delays to access ambulance because the system has changed in Carlow now. So often the ambulances are sent to other counties because of our location. So when an ambulance is gone, there's no ambulance to replace the one that's there. So we are experiencing a shortage. There's no ambulance there. It's not acceptable. I have reports of people with life-threatening situations waiting for 90 minutes or more for an ambulance. I've had calls from elderly people who have had to be brought to an emergency room in the back of a family member's car because there's no ambulance available. Now, this is where my concern is. This is what happened recently. All ambulance calls now are managed through the Central National Emergency Operations Centre now. So what it is it's supposed to ensure that the most urgent calls get the highest priority response, regardless of the location of your ambulance. And this is a massive issue. I just feel, and again, Minister, there's so much things happening now. So we have a base that's not fit for purpose. We now have our ambulance paramedics that are leaving our own county, and we have people in Carlow suffering. And I can tell you, there's an anger out there. There's an anger with people to know why are they being left so long. And this is not just in Carlow, because I'd say about 2 or 3 weeks ago, there was a meeting with Minister Stephen Donnelly, and the TDs and senators from the South East actually we had a virtual meeting with the Minister. And on that meeting that day, it was discussed about the issues concerning the ambulance, the delay in the ambulance services. So what I have to ask today is, what has been put in place for that? Did the Minister talk to you about this? And also, what is the update on it, and whether it's a new base for Carlow Town, or what is the situation? What is the progress on it? Where is the funding? And is it in the capital plan? Thank you.
Okay, I think it would be great if the Minister can answer your second question, but the primary focus is on the table, on the question you actually tabled. But anyway, God bless your versatility, Deputy Mayor.
Thank you. And again, I'd like to thank Deputy Murnane O'Connor for raising this issue of the provision of an ambulance base in Carlow Town. It's a town I'm very, very familiar with. The National Ambulance Service is a statutory pre-hospital emergency and intermediate care provider, and it seeks to serve the needs of patients and the public as part of an integrated health system through the provision of high-quality, safe and patient-centred services. Carlow Ambulance Base is an integral part of the ambulance services and has 4 emergency ambulances on duty. The base is supported by the National Ambulance Services resources from surrounding ambulance service stations, including Baltinglass, Athy, Kilkenny, Portlaoise and Enniscorthy. Dynamic deployment of available resources operates on an area and national basis rather than a county or geographical boundary basis, to ensure optimum resource use as the nearest appropriate resource is mobilised to the location of the incident. The priority of dynamic deployment is patient health and welfare in the context of service delivery, which means that resources cannot be confined by county boundaries, barriers or borders. The National Ambulance Service operates a comprehensive safety management system across all of its premises across the South and continues to work collaboratively with staff and HSE's estates external providers to ensure that any concerns or issues that occur are dealt with as quickly as possible. Remedial works to the value of approximately 50,000 were carried out at Carlow Ambulance Base, located in Carlow Town at the Carlow Health Services Complex on the Athy Road in 2020. And these works addressed requirements to make the ambulance base fit for purpose and included a list of maintenance types works to doors, walls, floor coverings and minor leaks with full certification of electrical and fire safety systems. Earlier this year, the National Ambulance Service completed a detailed prioritisation in the southern region. And as a result of this, the new base for Carlow has been confirmed as being the second highest priority for the NAS in the South East. And the NAS is currently working with the HSE estate in planning a future replacement for the current facility and has confirmed that a greenfield site has been identified and is under consideration. A capital submission for this project is being developed and capital funding for the project will follow in accordance with overall prioritisation planning.
Minister, I just wonder, when you say it's been the second highest priority, does that mean it's number 2 on the list, or does it mean that it's on a second list of other cases that may be considered? Anyway, just to
Thank you, Councillor. That was my question. When you say a list, I always get worried, Councillor, when I hear a list, because these lists go on and on and on. And even though I want to thank you, Minister, for your reply, it's actually not a reply, because first of all, let me state that the works that were done, the remedial works, didn't cost 50,000, because I have been up there several times in the base myself. There was the minimum works done, and the works that were done did not come to 50,000. And I have said that, and I will repeatedly say that that is, I believe, not true information. The other, I suppose the other concern I have is, right, can you again explain second on a priority list? I've been told that originally we were, I think, 4th or 5th on the list, then I was told we were 6th on the list, and now I'm told we're the second highest. But there is still no given confirmation that there is funding there, there's a time scale, when it's going to happen, what exactly is going to happen from this me having this discussion with you tonight, because I'm going back again to the paramedics and I'm going to say to them, well, I've been told again, you're on a list, I don't know what funding is there, you're on the Kelvin Grove site list. That is the only piece of information that I seem to have received tonight, and I would really like that information, please, given to me in a letter, if you wouldn't mind, Minister. I know you won't, just so that even though you said a site, but I need to have the site identified, but also I need to know what is happening with the funding, when is it going to happen, because we cannot have our paramedics who, as I said, I just couldn't give them enough praise and how hard they work, and yet I'm going back again, years and years now, still with the same thing, no answers whatsoever. And you know, I just feel that, again, it's disingenuous. I think tonight, again, I brought it up again, and I'm always, look, as I said, I'm constantly putting it for questions, I'm constantly bringing it up here. And I just even feel tonight, again, I'm not getting the answer. And the paramedics that are saving lives, that have worked, whether it's through COVID or whenever, they are not getting a building in 2021. We're going into 2022, and they have a building that's not fit for purpose, and it's not right, and it's absolutely neglect, I believe, on their part. Thank you very much.
Deputy, will the Minister can only supply you with the information he supplied with?
Yeah, well, again, I would like to thank Deputy Marina Connor for raising this very, very important issue of the provision of the ambulance base located at Carlow Town. And I don't have the information of where what area is higher on the list, but I will try to get that information from the Minister. I'll ask the Minister to forward it to you. And in line with Sláintecare and Vision 2020, a significant programme of work is underway to transform the NAS from an emergency medical service into a mobile medical service. And this is a model which aims to treat patients at the lowest appropriate level of acuity, resulting in a better experience for the patient and, I think, more efficient use of resources. And as you rightly said, Deputy, that Carlow Ambulance Base is an integral part of the ambulance service. You praised the advanced paramedics and the ambulance service and all the staff there, and I'd like to join with that and the great work that they've done, not just in Carlow and the South East, but across the country. And they are certainly saved lives, and we're very, very proud of them. And the capital spend on ambulance bases is an integral part of the ambulance service, and the capital spend on ambulance-based facilities is prioritised by the National Ambulance Services to meet the requirements of those bases with the highest needs. And I think that this year an unprecedented 187.5 million is being invested in the National Ambulance Service, which includes 10 million in additional funding to address priority areas in line with the NAS strategic reform, including continuing to target capacity deficits as identified in the NAS emergency service baseline and capacity review. Again, engagement is continuing between the NAS and HSE estates in progressing the capital submission for a replacement base.